am so smart, suddenly it just appeared. There's a light above my head, sometimes white and sometimes red. Bright ideas make it glow, and very soon the rest of the world will know. I just came up with a really bright idea. I am so smart, suddenly it just appeared. I just came up with another bright idea. I am so smart, suddenly it just appeared. There's a light above my head, sometimes white and sometimes red. Bright ideas make it glow. And
Hello, hello. Good morning or good afternoon, everybody. I want to welcome you to our final YT course for advanced coders. Yes, this is our final week. Can you believe it? If you have been following us week after week, I think this time just flew by. So we are on week 10 and we will be covering the medicine section today. So go ahead and let us know in the chat how you're doing. Hopefully you're having a great week so far, and we're going to get started. And I know you cannot wait to hear who the winner is of our lecture series. And we're going to announce that at the end of class. So stay tuned for that. We are excited. We do have a winner of our lecture series. So again, we will announce that at the end of class. All right, and guess what? We told you last week we were going to have a big surprise for all of you who attended today. So if for everyone who is joining us today, we have a special surprise just for you. So to claim your prize, this is what you do. Underneath this video, there's a comment section. Make sure to comment there in that comment section. Write us a comprehensive review about what you have learned throughout this class, or throughout this 10-week course. If it's your first time, you're just joining us for the first time today, that's all right. You can wait a few scenarios and then go ahead and give us a review. Just don't wait till the end because we may not see your comment. So make sure to get that comment in there. Let us know what you've learned, and we have a surprise just for you waiting at the end of today's class. Okay, so stay tuned for that. Okay. All right. And guess what? I announced this last week, but we do have a free course. If you feel like, you need some more basic knowledge of medical coding, we do have an introduction to medical coding course. And yes, it is free. Okay, it is an 8-week course. And the way that you sign up for it, you visit us at amcicoding.com. Okay, so go visit us on our website, click on the courses tab up at the across the top here, and a drop-down menu will appear, and you're going to go ahead and click down on the free Intro to Medical Coding course, okay, to fill out the application. Okay, all right, and this will open up. It'll give you some information about what is being offered here, and just click on the bottom, apply for the free course. Okay. All right, and don't forget that this course begins January 16th, but space is limited. So if you are interested in this, either yourself or if you have a family member, a friend, or a coworker who may be interested, go ahead and pass this information along to them as well, okay? All right, and I want to introduce you to our wonderful team. Please help me in welcoming the wonderful Miss Rochelle. Miss Rochelle is our Partnership and Marketing Director here at AMCI, and she is one of our lovely instructors. Hi, Miss Rochelle. How are you today?
Hello, hello, Miss Tracy. I am doing good. Hello there, Mrs.Jay. And hello, coders. How are you? Are you all ready for the final week? Can you believe it? Well, I just want to say it's been great 10 weeks with you all. And since this is our last class, I promise you, this probably, we're going to give it all out and you're going to learn something new today. So thank you for being here and thank you for staying with us all through these weeks. And I'm ready to get started, Miss Tracy. Thank you so much.
All right, all right. I'm ready too, Miss Rochelle. Thank you so much for joining us. And of course, we have the genius behind AMCI. We would not be here without this wonderful lady, our great curriculum director here at AMCI, and our wonderful instructor. Sorry, I'm getting tongue tied already. Hi, Mrs. J. How are you doing this morning or this afternoon?
It is this afternoon. I'm doing swell, Mrs. Tracy. How are you?
Doing well, doing well. Thank you so much for asking.
Awesome, awesome. Well, thank you for a wonderful 10 weeks and coders for you that have stuck by us for the past 10 weeks. You know what? I want to shout you out. And finally, last but not least, I want to shout out our instructors who relentlessly answered all of your questions in the chat. They encouraged you. Mrs. Tracy, can you help me and Miss Rochelle, can you help me shout out our team members in the chat?
Sure, sure thing. Miss Anna, thank you so much for being so diligent with us week after week coming in here. Also, Miss Sarah, thank you so much. Thank you, Miss Angela, Miss Valentina, Miss Tiffany.
Miss Tiffany, and we also have Miss Abby over there.
Yeah.
She is actually undercover instructor there. So, hello, Miss Abby. I know you're there.
Yes, thank you to you all. And thank you, most important team. But you know what? It's time to get started. So I'm going to take the screen and I have a question for you. I ask you this question every week. And you know what? I sometimes, wait a minute, let me take this screen. And I almost made a blunder. All right, so sometimes I ask you this, most of the time I ask you this question, and this is your question for today. I want to know, oh, I think my slides are a little they're a little different than I anticipated. Okay, so it's not time for me to ask you the question. It's time for me to tell you that you can win an AMCI lecture series. Can they win a lecture series, Mrs. Tracy? I don't think you can win a lecture series today. Somebody has already won. Yeah, and we're going to announce the winner at the end of this class. Yes, this is our last class, so absolutely we will do that. Now, I got a question for you. Yeah, we got a little hand chat, and that is the question is, how confident are you with the medicine chapter guidelines? Are you very confident? If so, type it in. Are you somewhat confident? If so, type that in. If you're barely confident, type that in or type in what you want. We just want you to talk to us. We want to know what you know. And I got a little disclaimer, got to tell you something that I, and I'm the instructor who is speaking. I cannot see what you're typing in the chat. Not right now. I can see it when I go in to answer questions in the chat. My job is to keep this going, keep this instruction going because we're on limited time. So I'm not peeping in that chat. And I just want you to know all those instructors that we've just mentioned, they are there. So is Mrs. Tracy, Ms. Rochelle, and they can answer your questions. And anytime an instructor is speaking, they cannot answer you directly. They'll answer you as soon as they're finished. All right, you ready to get started? I am. Okay, so let's begin with the table of contents. In the medicine section of your CPT manual, these are the subjects, or this is your table of contents. And it begins with your guidelines here, then the medicine chapter, and it begins with immune globulin serum or recumbent products, immunizations, administration for vaccines or toxoids, your vaccines and toxoids, and psychiatry, and then those subjects. Then you move down into biofeedback, dialysis, gastroenterology, ophthalmology, special otorhinolaryngologic services. Wow, that was a mouthful. Then you've got cardiovascular, you've got non-invasive vascular diagnostic studies, pulmonary, allergy and clinical immunology, endocrinology, neurology and neuromuscular procedures. And I think we're going to Oh, here we go. We've got medical genetics and genetic counseling, adaptive behavior services, central nervous system assessments and tests. You've got health and behavior assessment, intervention, hydration, therapeutic, prophylactic, diagnostic injections and infusions, and chemotherapy and other highly complex drug or highly complex biologic agent administration, photodynamic therapy, special dermatologic procedures, physical medicine and rehabilitation, medical nutrition therapy, acupuncture, osteopathic manipulative treatment, chiropractic manipulative treatment, education and training for patient self-management. And we're going to end it with non-face-to-face, non-physician services, special services, procedures and reports, qualifying circumstances for anesthesia, moderate conscious sedation, other services and procedures, home health procedures and services, medication therapy management services. That was a lot. And you know what? I don't know what to describe the medicine section as. As you can see, the other sections are pretty self-explanatory. It's either a body system or it's a path and lab radiology, very, very self-explanatory. But you see that the medicine section is a potpourri. It's a plethora of everything. Everything is in here. But what we do know is you will have some procedures, but they will be non-invasive, and that's all I can tell you. So, as you use your CPT manual, you will become accustomed to some of the procedures that you'll often encounter, and you'll know that they're found in the medicine section. All right, so just think non-invasive cardio, non-invasive anything else. All right, let's get started. Let's start with those guidelines and add-on codes. We know what an add-on code is. Just remember that add-on codes are found in the medicine section, and you cannot append a 51 modifier. This has the same meaning throughout the book, okay? And there are some codes that are exempt from modifier 51. So some of the procedures are from the medicine section, and you can find them in the exempt section. All right, next, use separate procedures. Yeah, we know what separate procedures are. We've talked about it throughout our 10 weeks and, well, 9 weeks, and this week is no different. A separate procedure typically are carried out independently. However, if you have a minimum of 2 procedures and one of those procedures is a separate procedure, make sure that that separate procedure is not integral to the other. If it's integral to the other, you're not coding that separate procedure. However, if it isn't integral, then you code it and you append modifier 59. So if you need to hear that again, all you have to do is wait until this presentation is over and then press rewind and listen to it again, but I'll say it very quickly. Separate procedures are typically carried out independently by themselves. However, they can be coded with other procedures. If you have a minimum of 2 procedures and one of those procedures is a separate procedure, make sure that the separate procedure is not related to the other procedure. If it is related to the other procedure, then you're just not going to code it. And if it's not related, then you will code it and you'll append modifier 59. Okay, in the medicine section, we have unlisted services or procedures, and here they are. It's not that many. And we know we use unlisted procedures when there is no code for it. Typically, for people who are in the real world, you'll be using these unlisted procedures, and you'll need to append a special report whenever you go to get reimbursed for these unlisted procedures. Image guidance is referring to supervision and interpretation, and these are typically coded or utilized whenever you have procedures in this section that are those, they're sort of surgical in nature, sort of, but they require 2 codes. You have to code for the supervision. The doctor is doing 2 procedures, okay? The doctor is providing that surgery or that procedure and doing that professional component too. So there, if you go to the image guidance, you will see the full extent of that guideline. It is green because they have changed it a little bit. So take a look at it. And finally, supplied materials. You will code supplied materials. Additionally, if it's not included in your code. All right, so let's get started. Let's start at the beginning. In the beginning, we talk about immunization administration for vaccines and toxoids. All right, so an immunization is a substance used to produce antibodies and provide immunity against a disease, one or many diseases, okay? So that is an immunization. It's an antibody. Now, a toxoid, which I find very interesting, is a toxin that has been chemically altered or modified. They use chemicals to change it, and or heat. So in other words, it's a bacteria that chemicals was used to make it right for administration. So a toxoid could be something. I think a good example of a toxoid is a bacteria or a virus that was modified in, let's say, the chicken pox, right? Yeah, so chicken pox is a toxoid. They take that chicken pox virus, they chemically alter it or modify it with heat, use heat to kill the bacteria, and they make it good. All right, so I moved on. All right, so let's go ahead and let's talk about coding these immunizations for vaccines and toxoids. And when you're coding these immunizations, 2 codes are required. An administration code, we call those the push codes. A push code is how the substance is being administered. Is it being injected, as you see on the screen? Is it going through an IV, etc.? That's your push code or administration code. And the next thing that you'll code for is the actual immunization or the toxoid. This is your product. This is what's inside that that push thing. This is what's inside of it. That's your product. So you got to code 2 things. The push, what they're using to put in your body, and the product. That's what it is, the product, the immunization or the toxoid. All right, so we've got some guidelines, and we're not talking about immunizations at this point. We're going to hold off a moment. Here are some immune globulins, serum or recumbent products. These are injections too, and people kind of confuse them with immunization. These are not immunizations, and you'll need to use codes 90281 through 90399, and you'll report these serum globulin extract serum serums, immune globulins or recumbent products with the following administration codes: 96365, 6667, 68, 69, 70, 71, 72, 74, and 75. And you can find them on CPT page 633. That's 2019 CPT page 633. So in other words, most medications involve a push and a product. They do. So there's your product, 90281 90399. And here is the way it's being administered, your push codes. And you can find them, it says on page 719. I don't know which is correct. So Ms. Rochelle, Ms. Tracy, if you know the correct page, please let me know. And I want to say two things about this. I find these immune globulins, serum, and recumbent products very, very interesting because people confuse them with toxins because, just like I said, they're bacteria, they're being modified with toxins. This is happening the same, almost similarly. However, serum globulins are extracted from human blood. Recombinant immune globulin products are created in the lab through genetic modification of human and or animal proteins. So, pretty much if someone is creating a they're creating an antidote probably from here. Probably. All right. Before I move on, does anyone on my team have anything to say? Tell me where those push codes are for these immune globulin serum or recombinant products.
Mrs.
Okay.
J, this is correct. The recumbent products are going to be on page 63, and
Mhm.
the push codes will be page 719.
Awesome, awesome, awesome. Thank you so much, Ms. Rochelle. All right, coders, I got a few more guidelines, and we're going to learn how to code immunizations. And the reason why we talked about these immune globulin serum or recombinant products first is because it's on the page, the very page before these immunizations. So now let's talk about immunization. And you've got your push codes or your um, administration codes, and you've got your product codes. All right. So this is how we are going to study. Here are the guidelines. All right, so it tells you to report your vaccine immunization administration codes 90460, 461, 471, 474, in addition to the vaccine and toxoid codes 90476 through 749. Okay, so there are your push codes and there are your product codes. Here are your product. Let me get my little red. That's your product. Those are your push. If you want to write it, you can, but I suggest you write it next to your codes, the actual code series. All right? So one thing that I got to tell you, when you are coding for 90460 and 90461, it's coded differently than 90471 through 474. And I think the best way to instruct is looking at the codes. So I do want to tell you that there are some guidelines here that you need to pay attention to. Whenever you're coding evaluation and management along with these immunizations, you will need to append modifier 25. And do not confuse these guidelines with your allergy testing, for skin testing, and for therapeutic or diagnostic injections. Don't confuse it because these are the code series for them. Now, let's go to the code series. At the top, you've got 90460 and 90461. 90460 is the code, is the parent that says that this code series is for someone that's 18 years of age and younger, and they have to have had a face-to-face counseling session with the doctor. Okay? In order to use this code, they have to be 18 years of age and younger, and a face-to-face encounter or counseling session with the physician had to take place. Your keyword is counseling. And when you do use this code, you code each component of that vaccine or toxoid. You code each component of the vaccine or toxoid. All right. So what does that mean? That means that when a patient has a DTAP, diphtheria, acidular pertussis, you have to code each one of those components. Diphtheria, tetanus, acidular pertussis. Guess how many products that is? That's 3 products. You have diphtheria, that's 1. Tetanus, that's 2. Acidular pertussis, that's 3. So you've got to code all 3 of those products. And the way you code it, this first code says is for the first component of each vaccine or toxoid administered. So the very first component, so I said DTAP, you're only going to code 90460 for the D. And then you'll use the add-on code for the other 2. 90461 will be the other 2. So it's a little more thinking whenever you're coding for these products than it is coding for the actual immunization. Like 90401, this is coding for that immunization. However, let's look at the guidelines right under the code. These can be used for any age, any age. No face-to-face counseling is required, and you code each vaccine separately. The difference between this code series, 90471 and 72, is that 90460, you have to meet all of these guidelines right here. All of these have to be met in order to use these codes. All 3 of these. Well, it's 2 main guidelines, and then you have to code it a certain way. So you got to meet those 2 main guidelines. If that's not happening, just skip on by, okay, and use this code series. Now, the difference between 90471 family and 90473 family, this is one vaccine. Oh, excuse me. Let me just move my little. Okay, this is the immunization administration, includes percutaneous. Where's my little? Includes percutaneous, intradermal, subcutaneous, and intramuscular injection. That's an injection. 90473, that's intranasal. It's going through the nose or the mouth, okay? Nose or mouth. Where is my little red? There it is. So this is going through the nose or mouth, and you might want to put it here, nose or mouth. I would, okay? And there you go. And this right here, 9047172, that's almost any type of vaccine. But it's they're intradermal, subcutaneous, or intramuscle. Let's go. I'm ready to read that next scenario. You ready? These are your guidelines, coders. Don't forget. And if you need me to read them again, I will. All right. Here we go. A, 99381 with a 25 modifier, 90702, 90647, 90713, 90460, 90461 times 3. B, 99381, 90698, 90460, 90461 times 3, and C, 99381 25 modifier, 90720, 90702 51 modifier, 90674 51 modifier, 90713 51 modifier, 90471 51 modifier, 90472 times 3 51 modifier, and D, 99381 with a 25 modifier, 90698, 90471. A mother arrives to the pediatrician's office for the first time with her 2-month-old baby girl. The infant was born at home, and the pediatrician did not have an opportunity to evaluate the infant in the hospital. The physician performed an initial comprehensive preventive medicine examination and administered 1 injection of diphtheria, tetanus, acellular pertussis vaccine, a cellular pertussis vaccine, Haemophilus influenzae type B or Hib, and inactivated poliovirus vaccine, IPV, via intramuscular route. What are the correct procedure codes for this encounter? Okay, coders, I'm going to give you a minute and a half. Okay, coders, how did you do? I gave you a little extra time because I was reading some guidelines myself. I want to make sure that I'm telling you the right thing. If you said D, outstanding. All right, so I started to advance the screen, and then these two codes came up, 90460. And you know what, coders? 90460 are the codes. I kind of remembered them for counseling. And I also know that these are counseling codes when the child is 18 years of age and under. Well, we do have a 2-month-old, but I don't see any counseling. Do you? No. So guess what? On site, I would have eliminated both of these. I just would. It's just a tip, but I digress. Let's move on. All right, so let's go ahead and do our due diligence. What are the key words? Pediatrician's office, first time, 2-month-old baby girl, initial comprehensive preventive medicine examination, 1 injection of DTaP, diphtheria, tetanus, acellular pertussis vaccine. And then you've got a Hib and an IPV via intramuscular route. And our task is, what are the correct procedure codes? Well, let's go ahead. All 4 answers have the new patient E&M code 99381. We know that. So we know that's correct. And if we look at 90698, this is the code for DTaP, IPV, Hib for intramuscular use. That is 1 code. And the documentation said there's 1 injection. 1 injection. So 1 administration and 1 immunization. So 1 push, and then all these products are in 1 um, in 1 vial. Yeah, I would say vial, or 1 syringe. So if that's the case, you're just really coding for the injections when you're using that 90471. So this is good. All right, so if you look at 90702, this is the code for the diphtheria and the tetanus, DT. There it is. But that's just not enough. It's all done in this 90698. So we're going to eliminate. I'm going to go back. We're going to eliminate A because it's coding separately 90702, and it's pretty much coding all of the components separately. So we're going to eliminate A. And we're going to eliminate C2 because C is doing the same thing, coding all of these components separate. So you got to go. And then let's look at 90460. We know this is immunization administration. However, we already peeped this card that 90460 is incorrect because there's no counseling. So any code with 90460 or 61, that is wrong. So we're going to eliminate B, and our answer is D. Okay, coders, if you got that correct, outstanding. But if you learned something, that is priceless. Now, I'm going to take a moment, I'm going to take a break, and I'm going to let Ms. Rochelle, she's going to do some more exercises with you.
Yes, Mrs. J, that is true. Thank you so much. Great explanation on those immunizations. Love learning those from Mrs. J. Very interesting and make it all so easy when you follow her lead on that one. So coders, I do know that you are going to be wanting more scenarios from this section. So I do have one. I think I actually have 2. So let's try this one out, okay? You ready? So we have A 90668, 90621, 90471, and 90472. For B, we have 90668, 90621, 90460, 90461 times 3. For C, you have 90668, 90621, 90460, 90461. And for D, you have 90668, 90621 with modifier 51, 90471, and 90472. An 18-year-old female patient visits her primary care physician to obtain immunizations prior to going off to college. After providing literature and counseling the patient on the risk of the vaccines, the physician administered the influenza virus vaccine and the meningococcal B11 vaccine. What are the correct procedure codes for this encounter? Okay, coders, I'm going to give you a minute and a half. I'll start the timer for you, and we'll get back and talk about this after a minute and a half. Good luck. All right. Okay, coders, if you got your answers, make sure you put them in the chat. And I have a good feeling you got this one. So if you followed the tip that Mrs. J showed you earlier, it should be pretty easy, okay? So let's see here. The answer is going to be C. Now, if you got it, great coding. If you missed it, come on and let's go and, you know, check on this one together, okay? I'd like to go over our keywords first. We have 18-year-olds. We have primary care physician, immunizations, we have literature and counseling. Okay, that counseling there is a really helpful keyword. We also have the vaccines, the influenza virus vaccine, the IIV, and the meningococcal B11 vaccine. And those are the things that we need to code. So we know that when you're coding for immunizations, you do need the push codes and the product codes, right? So looking at the answers you have in front of you, your first and second listed codes are the same, and these are your product codes or the component codes. Now, if I look at the administration codes or the push codes, there's where I will see the difference. So it's going to be either 90471 or 90460. So if you look at that, so we did have an 18-year-old patient, and the provider actually gave literature and counseling on this patient. So those are a good keyword because remember, two of these families are determined by whether or not one for age, and the second one is whether there's a counsel or not. And that 90460 is for the immunization. Hold on. 90471. My on clicks are off. 90471. Okay, if you look here, this family here, immunization administration code, and this one is the family for wherein there was no counsel was done during the encounter for the immunization. And since in our documentation here, it was indeed mentioned that there was a counseling, so we're not going to be coding your push code from here. So that would eliminate A and D, because we're going to be looking at 90460 family here for immunization administration through 18 years of age. So we're good because we're still in the right range. And the most important keyword here is that this one is for with counseling. And yep, my on clicks there are off, but yeah, this is going to be it. Now, we do have to code for the components. I'm actually going to drive your attention first to these components, and then we're going to go back in here to code for, for each component vaccines. Okay, so if you can just follow along with me here, you have your components here. Your product codes. Okay, so we already know we're coding from this family, and now we're talking about the products first. We have 90668. You will see that in all of our four choices, and that would code for the products for the influenza virus vaccine. Okay, that's just one product there, so we're good on that one. The next is going to be for the meningococcal, which would be coded as 90621, and this is also one product. And if you actually look at D, there's another reason for that to be wrong, because we do not append modifier 51 for this, so that should be eliminated, which we already did. Okay, so now that we know we have two products to code here, so we're going to go back to this family here for the push code or the administration code, because as you can see, the parent code here is coding for the first or only component of each vaccine or toxoid administered. So that 90460 is going to code for the first, vaccine for the one component, the influenza. Okay, we like that. And then we'll have to add another, the 90461 add-on code for each additional vaccine or toxoid component administered, because we do have one. We need that for the 90621 for the meningococcal vaccine. Okay, again, this is for the each additional vaccine, so we're going to need that. And all this parenthetical guideline would also confirm that our answer is correct there. So if you look at B, we do not need that multiplier 3, because meningococcal is only one vaccine or one component. Okay, so that would eliminate B. So your answer altogether is going to be C. 90668 and 90621 are two of your vaccine, the products, and 90461 and 90460 and 90461 is coding for your push or your administration codes. Okay, and that's it. So hopefully, I have a good feeling you got that correct. But if you learned something, then that is amazing. All right. Okay. So if you have any questions, go ahead and type them in the chat. And meanwhile, if you're ready for another one, as promised, I got another one. So let's go ahead. We have answer choices here: 90656 and 90471 for A, B 90656 and 90468, C 90656 and 90468, and for D, you have 90657 and G008. Okay, a 77-year-old Medicare patient presents to his primary care physician's office for his annual flu vaccine. The nurse administers a 0.25 milligram or ml dose of injection of the influenza vaccine. What are the correct procedure codes for this encounter? Encoders, I'll give you a minute and a half, and when you're ready, please put your answers in the chat. Alrighty, coders. I think you rock this scenario. Okay, so if you answer D for this one, then you would be correct. Okay, so keywords. We have 77-year-old, Medicare. That's a really good keyword there. Primary care physician's office, annual flu vaccine, 0.25 ml dose injection of influenza vaccine. So looking at your answers, you can either solve this by looking at your component codes, or if you're gonna look at that HCPCS code there. So if you look first at 90656, that is the code for your influenza virus vaccine. And this is coding for zero point 0.5 ml dosage for intramuscular use, which would be wrong because we were coding for a 0.25 ml dosage, okay? And that would be coded as 90657. So that should eliminate your all of your answer choices that has 90656. So see, that would be pretty easy. 90657, confirming that the keyword says, or sorry, the code description says influenza virus vaccine. You have your right dosage there of 0.25 ml dosage, intramuscular use. So that is indeed our product code. And of course, we'll need a HCPCS code for the vaccine administration, because remember, the CMS requires the usage of the HCPCS level 2 codes when you're coding for the Medicare patient. Okay, so with that being said, since we're coding for the Medicare patient here, so G008 administration of influenza virus vaccine is going to be what you're going to be coding for the vaccine administration, which leads us to answer D. So am I hearing some celebrations over there in the chats? I think so. So I better get back in there, hang out with you guys. Meantime, I think Miss Tracy is going to have a great discussion with you on dialysis. Right, Miss Tracy?
That is right. Thank you so much, Miss Rochelle. And everybody, keep it going in the chat. And let's go ahead and move on. And yes, we are going to talk about dialysis. So there are two main types of dialysis that's used for kidney failure. Both types filter your blood to rid the body of harmful waste, extra salt, and water. So as you can see, here we have hemodialysis and we have peritoneal dialysis. So in hemodialysis, it uses a machine, as you see in this first image here, and sometimes that machine is referred to as an artificial kidney, and usually go to a special clinic for treatment of this several times a week. In hemodialysis, during the treatment, your blood will travel through tubes from your body into the dialysis machine. And while your blood is in the machine, it goes through a filtration process, and it's called a dialysis. I always get this word dialyzer, I think is what it's called. And that removes waste and extra fluid. Okay. Once it has been cleaned, the blood travels through tubes from the dialysis machine and it goes back into your body. Okay. So that's basically the process of that one, that image on the left. Now, the image on the right, the peritoneal dialysis. Do y'all remember peritoneal from your anatomy and physiology? Anyways, this is a treatment that uses the lining of your abdomen. So that peritoneal, that's the belly area. Okay, and there's a cleaning solution called a dialysate that cleans your blood, okay? And the cleaning fluid flows through a tube or a catheter, okay? So you see the dialysate is right here and it comes down through um, this tube and it goes in through a catheter into your peritoneal, okay? Which is the lining of your abdomen. And the lining of your abdomen basically acts as a filter and removes waste product from your blood. And after a set period of time, the fluid with the filtered waste products will flow out of the abdomen and is discarded, as you see right here. There you go. The discard bag's right there. All right. And so one advantage of doing this peritoneal dialysis is it can be done at home, whereas the hemodialysis is either usually done in a treatment facility or in a hospital. Okay. All righty. So let's go ahead and talk about some guidelines. Yes, we have some guidelines. Okay, so codes 90935 and 90937 are reported to describe the hemodialysis procedures. And important to note here that all evaluation and management service that is related to the patient's renal disease on the day of dialysis procedure is going to be included, or in other words, bundled, okay? So your E&M that is associated with that renal disease or that dialysis is going to be bundled, okay? code 90935, you would report if there's one evaluation of the patient, and you report 90937 if there is reevaluations that are required, okay, during the hemodialysis procedure. Now you can use you would append modifier 25. You can use E&M codes here and append modifier 25 only if it that service is separately identifiable, or in other words, unrelated to the dialysis procedure, okay, or the renal failure. All right. Otherwise, again, it will be bundled, okay, if it is related. All righty. Okay, so let's go ahead and talk about miscellaneous dialysis procedures. So codes 90945 and 90947 describe dialysis procedures other than hemodialysis. For example, we talked about the peritoneal dialysis. So this is where that would fall if you're doing something other than hemodialysis, such as peritoneal dialysis, hemofiltration, or continuous renal replacement therapies, okay? Again, same guideline applies as far as the evaluation and managements that are related are going to be bundled, okay? Code 90945 is reported for the one valuation, and if there's a reevaluation that is required, then you would report 90947. Use modifier 25. It's basically the same exact thing I just said before. If it is unrelated, you can report an E&M, okay, and you append a modifier 25 to that, okay? And again, your keyword is unrelated to the procedure or the renal failure. All right. Codes 90951 and 90962, these are reported once per month to distinguish age specific. So these are age driven codes. So basically, really pay attention to the age when you're coding in this code range. Those codes would be for the outpatient setting. So you need to know if you're in an outpatient setting, inpatient setting, or if you're at home. And this is what it includes. Okay, those codes include establishment of a dialysizing, sorry, that word always gets me, dialyzing cycle, outpatient evaluation and management of the dialysis visits, telephone calls, and patient management during the dialysis provided during a full month. Okay, that's your keyword, a full month. In the circumstance with the patient has a complete assessment during the month and services are a period of less than a month, then you use 90951 to 90962 according to the number of visits that were performed. Okay, 90963 to 90966 these again are reported once per month. The keyword here is this is for home dialysis patients, okay, whereas the other ones over there were for outpatient setting. For ESRD or end-stage renal disease and non-ESRD dialysis services performed in an inpatient setting, and for non-ESRD dialysis service performed in an outpatient setting, you're going to report 90935 to 90937 and 90945 to 90947. Evaluation and management services unrelated to the ESRD services that cannot be performed during the dialysis service may be reported separately. Okay, so we have our little ad. It can be reported if it's unrelated. Okay. Codes 90967 to 90970 are reported to distinguish age-related services for ESRD for less than a full month of service per day. Okay, so you would have to do this per day. Okay, you would report those codes per day. And then this is the circumstances that you would follow for that. Transient patients, partial month where there was one or more face-to-face visit without the complete assessment, sorry. The patient was hospitalized before a complete assessment was furnished. Dialysis was stopped due to recovery or death, or the patient received a kidney transplant. And just note here that each month is considered 30 days. okay? And then if you look on page 644, there's some examples there. So you might just want to read through that just to show you, it's kind of showing you how to code if the patient didn't receive, was hospitalized for a portion of that dialysis, okay? All right, and here is our first scenario. All right, here's our answers. A, 90957, B, 90960, C, 90970 times 20, or D, 90960 times 10. For the month of April, Dr. Bass documents the following monthly services for a 67-year-old female patient who receives dialysis at Ready Creek Dialysis Center. In addition to ESRD, the patient has hypertension and is anemic. Dr. Bass documents 4 face-to-face visits with the patient. During the last face-to-face encounter, Dr. Bass, or Dr. Bass, so however you want to say it, recommended the patient be transported to the hospital for further workup. The patient was admitted into the hospital for a 10-day confinement. What is the correct procedure codes for this encounter? All right, you have a minute and a half and your time begins now. Good luck, coders. All right, get those answers in. Okay. All right. So if I look at my answers here, I noticed that B and D have the same first listed or have the same code, but we have a multiplier on D. We have a multiplier there on C. So it's just some things to look at. Okay. And I'm going to go to my keywords. Oh, sorry. Answer coming first. Answer is C. Okay. So that's going to be our answer. And let's go to the keywords. We have month of April, Dr. Bass, monthly services, 67-year-old, dialysis, ESRD, hypertension and anemic, 4 face-to-face visits, last face-to-face encounter, admitted for a 10-day confinement into the hospital, okay? All right, so let's go ahead and look at our first code here. 90957, this is for ESRD related services monthly for patients 12 to 19 years of age. So remember, these are age driven. That's why I said really pay attention to the age, because if we know our patient's 67 years old, we definitely know this is not going to be our code, because this is coding for a patient that is 12 to 19 years of age, okay? So wrong age, so we don't have to even really give that another thought. We can just go ahead and eliminate it. Okay, 90960, this is ESRD related services monthly for patients 20 years of age or older. So the age is good there, with 4 or more face-to-face visits. It did say we had 4 face-to-face visits here. However, this is for monthly. So the physician can only report this if there was a full month of this ESRD services given. And in this case, because if we look right here, The patient was admitted to the hospital for a 10-day confinement. So remember, the month is defined as those 30 days. So of those 30 days, the patient was admitted into the hospital for 10 days. So we cannot report this 90960, okay, because this physician didn't provide a full month of services for this patient, okay, due to that 10-day confinement. So based off of that, we can go ahead and get rid of B, and we can also get rid of D, because what D is doing, it's coding for the 10-day confinement, but the doctor needs the code for what was outside of that 10-day hospital stay, okay? So what took place in basically the outpatient setting, okay? So we can go ahead and get rid of D. And if we look at 90970, that is going to be for end-stage renal disease related services for dialysis less than a full month of service. Okay, yes, that happened here. And it's saying per day. So we're going to have to calculate per day. And if you look at 90970, our age, 20 years of age and older. So I like that. So basically, we're going to calculate, because remember, the month is based off of the 30 days. The patient was hospitalized for 10 days, so we're just going to subtract that, and we're left with the 20 days to code, okay? So we're going to code 90970 times 20, okay? So that makes C the correct answer. All righty. Okay, let me know what you thought of that one in the chat, okay? Did you have an aha moment there? Okay, let me know, and I'm going to go ahead and I have another one for you. And our answers are A, 90937, 99233 times 2, B, 90945, 99233, C, 90945, 99233 times 2, or D, 90947. A 57-year-old male patient with ESRD was admitted to the hospital by his primary care physician after testing positive for the H1N1 influenza virus. While in the hospital, the nephrologist carries out a peritoneal dialysis procedure, and he visits the patient a total of 2 times during the confinement. During both visits, the physician conducts a comprehensive history and exam with high complexity medical decision making. After assessing the patient's fluid status, risk for coagulation, BP, blood flow, and lab results, patients prescribed dialysis treatments were decreased to once per day while the patient is confined. What are the correct procedure codes for the encounter? All right, a minute and a half, coders, and your time begins now. Good luck. Okay, everybody, get your answers in the chat for us. And I have a good feeling about this one. I think you guys probably rocked this one. So let's go ahead and look at this. The first thing I noticed is A, B, and C first or second listed code all are the same, okay, with the exception of those multipliers, but the code is the same, okay? And then we have, let's see, B and C, first listed codes are the same, all right? And if I know my codes here, I know that the 99233 is going to be from the E&M section, okay? All right, so let's go ahead and take a peek at what's going on. Actually, let's look at the answer, sorry. And the answer is D. Okay, let's find out why. Our keywords are 57-year-old, ESRD, admitted, hospital, primary care physician, nephrologist, peritoneal dialysis, total of 2 times, comprehensive history exam, high MDM is done, dialysis decreased to once per day. Okay, all right, so again, looking at 99233, that's my E&M code for a subsequent hospital visit. Now remember what I said when we were talking about those guidelines? All E&M services that are related and done on the day of the dialysis treatment is going to be bundled. Okay, so all those E&M services are going to be bundled unless we can report it if it is unrelated. However, this is going to be related, okay? Because this physician's assessing the patient's fluid status, risk for coagulation, BP, blood flow, lab results, and based off of that, he's making a decision to decrease to once per day. So that E&M service is going to be bundled into the dialysis procedure, okay? So based off of that, I know A, B, and C are wrong, but you know what? I still want to look at these codes. Let's look at 90937. That is also wrong because that is for hemodialysis, and what's happening here is going to be the peritoneal dialysis. So remember, we code that from a different set of codes. All right, so we can go ahead and get rid of A. 90945, that is for peritoneal dialysis. However, that is for a single evaluation. And multiple evaluations were done here. It says that the patient was seen a total of 2 times. Okay, so we had 2 evaluations there. And so we can go ahead and get rid of B and C. And if we look at 90947, that again is for peritoneal dialysis, okay, or something other, dialysis other than hemodialysis, including peritoneal, which was done here. And this required repeat evaluations, okay? And that is going to be our code. All right, so D is the correct answer. Okay. Okay, so what I'm going to do is hand this over to Miss Rochelle. She has something to talk to you about, some more guidelines, another section, and I will be hanging out in the chat. So if you have any questions at all, please ask me there, and I'll see you there. Back to you, Miss Rochelle.
Thank you. Thank you so much, Miss Tracy. Wow, great discussion there. And coders, okay, so I do have some sections to talk to you about. Now, remember that under the medicine section, we actually are going to be coding a few cardiovascular sections. That would be your code range 92920 to 93799. And part of this sections is going to be cardiography. So I know that probably the biggest section from this medicine section, cardiovascular, is the coronary therapeutic services and procedures. But hold on to that, okay? Because that's coming up next. All right. So I know that's going to be a good one too. So first, I do have to talk to you about cardiography. So this one is really quick. So again, within the medicine section are codes for cardiovascular stress test, okay, referred to as cardiography. And as you can see here in my little mini picture here, you can see an example of a physician conducting a cardiovascular stress test on a patient using a treadmill. Now, this procedure determines how well the heart and the blood vessels are working. And during a stress test, an echocardiography, the patient will exercise on a treadmill or sometimes could be a stationary bike while the doctor monitors blood pressure and heart rhythm. Now, in coding world, there is a specific way to code these procedures or these methods or services depending on the components of the services performed. And that's what we're going to be looking at. So this is basically the guidelines for cardiography. So there are it's a very important thing to know the setting when you're coding for this. So I think the best way to explain these codes, because they are kind of different from all the rest, they don't need modifiers to indicate which particular services you're going to need. So let's start here. So we have this doctor's office. So as we know, in a doctor's office, in an outpatient setting, a code would have a global package, right? So say for example, a patient comes in an outpatient facility, and the doctor recommends to do a stress test with this patient. And since this doctor who owns or partnered or owns this equipment or the facility basically, in this one setting here in an outpatient facility, most likely this doctor is going to do the tracing, which would include the use of the equipment or owns the machine or the equipment. And then during that test, the doctor, probably the same doctor, is going to supervise and also do the interpretation and report. So in this case, we would see a global package being coded for this doctor. Again, the use of the machine, the supervision, and the interpretation and report. So in this case, so that's what we call that the global package code. So this doctor is going to be or in this service, the services is going to be coded as 93015. Okay, for your stress test, for the global package, again, for the use of the machine and the supervision and the interpretation report. So both, you have your technical components and your professional components for the doctor. Okay, now remember, if you look at these codes 93015 and the whole family of those that series or that section, that family, you do not actually need to append modifier TC or modifier 26 on them, because those specific services provided for or is going to be already indicated in the code description. So you cannot use a modifier 26 or a modifier TC on them. So if you're looking for the code for a global package, again, your code has to be 93015. Okay, so hopefully that makes sense. Now, there is another code from this family here, and those are applicable for, say, for example, in an outpatient facility, we're in, or say, for example, we're in a patient or has to use the machine from a hospital in order for that to use the stress test procedure. So say, for example, here, a doctor or a patient comes in on a visit from a doctor, and the doctor has a the doctor recommends to do a stress test with a patient. However, the doctor does not have the machine to do the stress test. So what's the doctor going to do is maybe send the patient to a hospital who could provide a machine. Okay, and then the doctor is probably going to go there and do the services, the professional services of it. So say for example, Mr. Lim comes to the hospital, go to the cardiac suite or section or the laboratory or whatever that is. So she goes in there and uses the equipment, and his doctor here is going to be with them to provide the supervision only. So in this case, say for example, we already split the code. So this doctor is going to only be paid for the doctor services. So if the doctor is only supervising the procedure, then the doctor's code or this services will be coded as 93016. Okay, supervision only. Now, if the doctor services in this encounter is only for an interpretation and reporting only, the code will have to be 93018. Okay, again, we're talking about the doctor here. And remember, if for some reason or during this encounter the doctor supervises and also provided interpretation and report, then you can go ahead and code 93016 and 93018. So all of those doctor services or professional components, okay? Now you may ask, so what happened with the hospital then? So what happened to the use of the equipment or the machine? Well, that's where your code for the tracing only. So the tracing would cover your technical, the use of the equipment and the machine, and that would be coded as 93017. So as you can see, basically there is a specific code for the services rendered here, and you have to code them as to what your services are documented for. Okay, so because remember, you do not need to add modifier technical component or modifier 26 on this one. It has to be coded specifically to the services rendered. Okay, Hopefully that makes sense. And I think the best way for us to understand this one is by doing a scenario. So let me go ahead, move this over here, and let's try this scenario, okay? So we have answer choices A, 93015, B, 93018 with modifier 26, C, 93016 with modifier 26, and 93018 with modifier 26. And for D, you have 93016 and 93018. A 67-year-old male patient with a history of hypertension, diabetes, CKD stage 2, a 50-year-old history of smoking dependence, and intermittent chest pain upon exertion, presents to the hospital for cardiac stress testing. Previous resting ECG studies were normal. Using ECG monitoring, the patient will undergo a maximal treadmill exercises with continuous ECG monitoring. The cardiologist will supervise and administration of the pharmacological medication and assess any new symptoms resulting from the testing and interpret the final report. What are the correct CPT codes for the professional services for this encounter? All right, coders, now it's time for you to find the code, and I'll put the timer in for a minute and a half. And when you're ready, please put your answers in the chat. Okie dokie, that is time. Get your answers in, coders. And if you said the answer is D, then you would be correct. So let's go over here and take a look at our keywords. We have 67-year-old, hospital for cardiac stress testing. We have ECG monitoring, cardiologist, supervise, administration of pharmacological medication, and assesses, interpret the final report. So remember here in this encounter, actually the patient went to the hospital to do the stress testing, meaning to say that the doctor does not own the equipment. So it's not a global package. So remember these codes that we talked about earlier in the diagrams. The 93015 covers the comprehensive or the global package, which would include the use of the machine, the technical component, and the professional services. Okay. So that is it. The 93016, remember, this is for a professional component for supervision only. 93017 is a technical component for the tracing only. And 93018 is the interpretation and report for the professional services component. Okay, so having that makes it a lot easier, I guess. So now also one thing, if you remember, the use of modifier 26 is not applicable for these codes because again, these services already specify the type of services you need to use. Okay, so it's already in the code description. So that being said, we can actually go ahead and eliminate B and C right off the bat. We do not need those modifier 26. Okay, so 93015, we already know this as the global package. And again, we mentioned that this one here, we have to split it up because this doctor providing the services does not own the equipment. They have to go to the hospital to do this cardiac stress testing. Okay, so this doctor will only be coded for the professional services. Okay, so 93015 is not applicable in this case, so we're going to go ahead and eliminate A. And that leaves us to answer D, 93016. That is the cardiac stress testing. And this is the supervision only, okay, without the interpretation and report. So we're picking this up as the professional component for the supervision only, because indeed, this doctor supervised this patient while doing the stress test. So we need this code. Also, this doctor, the same doctor, also provided the interpretation and report only, which would be coded as 93018. So we need this code as well. So altogether, your code is 93016 and 93018. That covers for the professional services for your doctor performing these services. Okay? Alrighty, righty, all good. And if you have any questions for me, I'm gonna join you in the chat. Meanwhile, here it comes. You're gonna like the next one coming up, and I'm gonna turn you over to the amazing Mrs. J. You ready, Mrs. J?
I am ready. I am just doing some last minute stuff. I always do that. You did a phenomenal job, Ms. Rochelle.
Thank you.
Outstanding, outstanding. I love the visuals and I know they got it. I know they did because I saw them. All right, so let me go ahead and take over. Thank you for sharing your screen. Okay, coders. Guess what? This is some of you all's favorite thing to code in medicine section. Okay, I might be being a little facetious. Some of you may not like this, but after today, I think you're going to have a different perception about coding percutaneous coronary intervention. Percutaneous coronary intervention, think about the three words percutaneous, typically using a catheter. They go to the coronary, let's say a coronary vessel, and they intervene. And if you look at the screen, these procedures usually treat blockage like atherosclerosis, ASHD, but blockage within the coronary vessel. And the intervention takes place when the doctor inserts a catheter and kind of pushes, or yeah, I'll say pushes back or intervenes in that blockage and permits the blood to flow through that vessel. All right, so let's take a look at some of the more common procedures. The first, this is the most common. This is called an angioplasty, but specifically a balloon angioplasty. If you look at the first image, you've got, this is definitely you've got some blockage, you have some occlusion, and you see the catheter. The catheter is entering the vessel where the occlusion is, and then the doctor fishes that catheter all the way through so that the doctor can blow up or inflate a balloon. That's why it's called balloon angioplasty. And then the doctor takes the catheter and removes it, leaving that balloon in place. And this helps to keep that artery open. It allows the blood to flow through that vessel. And this doctor has just intervened percutaneous coronary intervention. All right. Another procedure that's common is the stent placement. We kind of saw the stent at first, but I wanted to do it in this order. All right, so in the picture above, you got some blockage. See the little blockage? You see it better here. Same concept. They take a catheter, they insert it, they fish it through the vessel. Then when they get to just the right spot, they inflate it with a balloon. However, there is a cage around the balloon. See this cage? And that cage is called a stent. And when they inflate it just enough, They take the balloon and the catheter and remove it, leaving the stent in place. And they intervened via the coronary vessel, percutaneous coronary intervention. And then the third procedure is atherectomy. And pretty much they use a catheter. However, they use a device, a cutting device, to cut away the occlusion or the plaque or whatever it is, the hardening of the arteries, whatever it is that's blocking that vessel, they're cutting it away. All right, coders, these are the most common forms of percutaneous coronary intervention: your balloon angioplasty, stent, and atherectomy. Now let's take a look at these guidelines. In your CPT, pages 658 through 659 are your percutaneous coronary intervention guidelines. And pretty much they are as follows. It tells you that these guidelines are built on progressive hierarchies. Yes, so the higher the level, it will take precedence over the lesser. That's just important to know. And then there's a bunch of stuff that's bundled into it that's standard. When you have an opportunity, go ahead and take a look. And you have some guidelines on diagnostic angiography, typically bundled if the contrast well, these are bundled if you are reporting for contrast injections, angiography, road mapping, and or fluoroscopic guidance for the coronary intervention, for vessel measurement for the coronary intervention, or for post-coronary angioplasty, stent, atherectomy, angiography, as this work is captured in the codes. All right, so that's bundled. Now, your diagnostic coronary angiography is not bundled and coded separately if no prior catheter-based coronary angiography study is available and a full diagnostic study is performed, and a decision to intervene is based on the diagnostic angiography, or a prior study is available but is documented in the medical record. The patient's condition with respect to the clinical indication has changed since the prior study, or there is inadequate visualization of the anatomy and or pathology, or there is a clinical change during the procedure that requires new evaluation outside the target area of intervention. And so that's for diagnostic angiography. You need to know if it's bundled or if you're coding it separate. But also when coding PCI, you will need to know the major coronary arteries. Yes, you do. And here they are. You have your left main, left anterior descending, left circumflex, right main, and your ramus intermedius. My advice is to know them. And these below are your HCPCS level 2 modifiers. And if you go to the HCPCS level 2, the modifier section, I believe that's Appendix B, you will see the definition of these vessels. So it's important that you know these vessels, because anytime you're coding for intervention within these vessels, you'll need to append that modifier. And you'll also need to know the coronary artery branches, as well as the fact that we code for coronary artery bypass grafts. So if you have a bypass graft that you're coding for, yes, PCI can take place within that vessel, definitely. All right, so that's all we're going to talk about for now. And let's go back to the first guideline. The guideline that these percutaneous coronary interventions are built on progressive hierarchies, with the more intensive first, and the more intensive are coded first, and they are inclusive of the lesser intensive procedures. And let's take a look. Let's just go ahead and take a look at that a little more closely. All right, so Um, to the right here in this green section, you have the guidelines that tell you the hierarchy right here. And I'm going to show you very shortly what they are. I'm just going to kind of make it a little more clear for you. And also you have a guideline when you have a single lesion that extends from one target vessel to another and how to code it. Coders, let me give you some advice. Code the number of intervention technique. So if you're coding for one stent, that's all you're coding for. And that one stent is in two vessels, it spans two vessels, you're going to code one stent. If the doctor applied two stents, you're going to code two stents. Okay, just as a rule. Also, when you have bifurcation, when bifurcation takes place, let's say the patient's anatomy is a little different, and let's say the vessel bifurcates or splits into two pieces, and let's say that they use one intervention, technique, then you just use code for one. If they use two, code for two. All right, coders, let's take a look at these codes. All right, so for coding for revascularization for total occlusion or blockage, 92943. That is what you're going to code. This is the highest ranking of them all. This is when a person is totally occluded. That means that vessel is totally blocked. 92943, the highest ranking. The next is revascularization for acute myocardial infarction. When you have acute myocardial infarction and that physician's in there trying to revascularize, open up that vessel, 92941. Next, you have atherectomy with stent, with or without angio. You see, this is another procedure, another PCI integrated into this atherectomy. You've got stent and angio, both stent and angio, in addition to atherectomy, 92933. And then you've got atherectomy with or without angio, 92924. You've got revascularization through a bypass graft, 92937. Then you have a stent placement with or without angioplasty, 92928. You have angioplasty. This is a balloon, percutaneous coronary intervention or angioplasty, percutaneous coronary angioplasty, 92920. This is the code for the most basic and the lesser of all. Now this is how it looks if you like to see them in order, 1, 2, 3, and you see 92943, 41, and 33 have the same weight, but if we had to choose one, 92943 outranks them all, followed by 92941. And I don't know where that little red dot came from, but I better get going. And if you are a chart person, here are the PCI procedures in the order of hierarchy. Okay, now let's take a look at our codes. Yes, this is, I think, key to actually coding very well. Just really, really capturing the essence of coding percutaneous coronary interventions and also coding correctly. What I would do, I would put my order of hierarchy on my page. I certainly would. And I would just go next to my code and put what it is. 92920, that's angioplasty or PTCA, percutaneous coronary angioplasty.
And 92924, this is your atherectomy code. 92928 are your stents. See the S in parentheses. 92933, you see your atherectomy and your stent. 92937, you've got your bypass graft. 92941 is your acute myocardial infarction revascularization. And 92943, your total occlusion. If you're coding for a total occlusion, there it is. And you know, one other thing I would do, I would put my coronary vessels at the bottom of the page just so I'm ready. And go ahead and screenshot it if you want to. Add to it, coders, take away from it, do what speaks to you, because I am ready for my scenario. Are you? Let's go. All right. A, 92928 LM, 92929 LC, 92978 times 2. B, 92928 LM, LC, 92978, 92979, 93454. C, 92928 LM, 92928 LC, 93454. 75736 with a 26 modifier. And D, 92928 LM, 92929 LC, 92978, 92979, 93454, 75736 with a 26 modifier. A 57-year-old male patient arrives to the ED with chest pains. After a complete cardiovascular workup, the patient was diagnosed with unstable angina pectoris by the ED physician. The patient was ambulated to the hospital's angiography suite for further assessment and possible cardiac catheterization. Via left brachial approach, catheter was placed into the aorta. Angiography confirmed severe stenosis at the left main coronary extending into the left circumflex. Additionally, intracoronary ultrasound performed on both vessels confirmed the stenosis, necessitating percutaneous coronary intervention. The physician was able to use a single stent to address the stenosis in both coronary vessels. What is or are the procedure codes for the professional services for this encounter? Okay, coders, I'm going to give you a minute and a half. Okay, coders, I know I give you a few seconds more. The answer is B. If you said B, outstanding. All right, coders, I know you saying, hey, why didn't you tell us the guidelines ahead of time? I sort of did, but I condensed the guidelines for you. So I'm going to show you on the next slide. I think it's more important that you attempt it yourself, and then we can work it through if you need it. All right, we have a 57-year-old. Uh-oh, look at that. 57-year-old diagnosed with unstable angina pectoris. We've got the angiography suite, further assessment via left brachial approach, angiography, left main coronary, extending into the left circumflex, and then intracoronary ultrasound performed on both vessels. Okay, we've got, I think that's out of order. We got percutaneous coronary intervention. There you go. There's your both vessels. And you've got a single stent. All right, coders, kind of think about what I said earlier, and let's try and do this. And here are some guidelines for you. All right, so when you're coding these are some things you should keep in mind. Number one, is this, or am I coding for a major vessel? What are the major vessels? Why, they are the HCPCS codes that I told you about earlier. They are your left main, left diagonal, you've got your left circumflex, left anterior descending, left circumflex, your ramus intermedius, and your right main. All right. And they also, whenever, going back to this, if was a procedure, was an intervention, what was the procedure or the intervention? And in our case, you should be able to answer that. It was a stent. Also, don't forget to code the highest ranking code. We talked about that earlier. Use the appropriate add-on code. I'm going to show you that. Angiography is typically bundled, and they're your reminders down there, your vessels, your reminders. All right, coders, so was a major vessel? Are we coding for a major vessel? Well, we got the left main. There's the left main. And the left circumflex. The left circumflex. So yeah, we're coding for 2 vessels. Yeah, so yeah, we're coding for a vessel. And we're coding, our procedure is a stent, but it says a single stent. Who remembers what I said? Okay. All right, coders. Let's look at our codes. We have 92928. This is percutaneous transcatheter placement of intracoronary stents. I like this. With coronary angioplasty when performed, single major coronary artery or branch. Okay, coders, this is a good code. Let's put a star by it. In fact, all of these selections have that code, so we know it's a good code. Now let's look at 92929. This is for each additional branch. Each additional branch of a major coronary vessel. So coders, you would not use 92929 for a major coronary vessel. You would use it for a branch. And if you don't know what the branches are, I think I have a free, I do. I have a free video here on YouTube that goes over those branches. All right, so I digress. Let me come back. All right, so we like this 92928. This is stents with coronary angioplasty when performed, single major coronary artery or branch. All right. And what took place is, additionally, an intracoronary ultrasound was performed on both vessels, both the left main coronary and the left circumflex. I like that. So if we go down to 92978, this is endoluminal imaging of coronary vessel or graft using intravascular ultrasound. IVUS, or optical coherence tomography, OCT, during diagnostic evaluation and/or therapeutic intervention, including imaging, supervision, interpretation report, initial vessel list separately, in addition to code for primary procedure. I like this too, this 92978. It looks good, but we can look at A and we can see that this is not correct because 92929 LC, this is saying that this is a coronary vessel, and we put the modifiers on the coronary vessels. Is 92929 a code for a coronary vessel? No, you should never put a coronary vessel on a branch code. This is a branch of a major coronary vessel. So guess what? A is incorrect. And what else is incorrect? So is D. They're putting the wrong modifier on the wrong code. All right, so that leaves us with B and C. And we know that 92978 is the code for intravascular ultrasound, for the initial vessel. And then if we look at 92979, this is for each additional vessel. Yeah, because we know that an angiography was done on the left main coronary and the left circumflex. So we would need both codes. And let's see. If you look at C, C does not code for that additional vessel. Yeah, so we can eliminate it right there off the bat. It's got to go. But B is correct because it does code for 92928. It's LM and LC. It's acknowledging one procedure, one stent placed on both of these vessels. And it's coding for the ultrasound, the initial vessel. It's coding for the subsequent or additional vessel for the ultrasound, and it codes for the catheter placement. Yes. So B is our answer. And coders, if you got that correct, outstanding. But even better, if you learned something, that's priceless. Okay, coders, I think I have one more, and then it'll be Mrs. Tracy.
I think it might actually. Oh, it is you still, Mrs. J. I'm sorry. I thought it was me again
Eh,
already.
it is. I just wanted to call your name. Okay, here we go. A, 92928 LD, 92929, 93454. B, 92928 LD, 93454. C, 92928 LD, 92929 LD, 93454, 7573626 modifier, and D, 92928 LC, 92929 LD. A 63-year-old female with coronary artery disease presents to the hospital's angiography suite for a full study diagnostic coronary catheterization with possible intervention. This is the first time this patient is having this procedure via left femoral artery approach. A catheter was placed into the aorta. A microcatheter was inserted to perform the angiography. Stenosis at the left anterior descending artery with bifurcation to the first diagonal artery was revealed. Both vessels were stented. What is or are the procedure codes for the professional services for this encounter? Okay, coders, you have a minute and a half. Okay, I gave you a few more seconds. How did you do, coders? Okay, if you said A, outstanding. All right, if you know what, let's go back. I told you something on the previous instruction. I told you that 9299 is a branch code, and you should not put a modifier on branch codes because the modifiers are for your major coronary vessels, and you don't put major coronary modifiers on branches. And therefore, look at C and D looking so wrong, wrong as can be. All right, let's go ahead and solve this scenario. Our keywords: 63-year-old, angiography, full study diagnostic coronary catheterization, possible intervention, first time via left femoral artery approach, angiography, stenosis at the left anterior descending artery, bifurcation, first diagonal artery was revealed. Both vessels were stented. All right, coders, here are our guidelines, and let's answer them. Are we coding for a major vessel? We're coding for the left anterior descending, and we're coding for the diagonal arteries. And if you watch the lecture that I was referring to on YouTube, and I think it's called PCI, I teach you that the branches are diagonal branches are a part of the left anterior descending, and they are branches. So yes, we are coding for a major vessel and a branch, and both of them were stented. Hey, I think we can see the answer right here. 92928, we know this is the code for stent. We had two stents. Look at that apostrophe S. You can use this for both stents. And this is a single major coronary artery, 92928. And then 92929 is for each additional branch of a major coronary artery, 92929. So we know that if we're looking at A, B, C, and D, B is not even coding for that additional branch. No. So we're going to eliminate B. Next, we have 93454. This is catheter placement in coronary arteries for coronary angiography. Okay, that did happen, and it includes injections, angiography, imaging, supervision, and interpretation. I like it a lot because catheterization did take place. But if you look at code 75736, oh, I'm sorry, let me go back. I got a little ahead of myself. If you look at D, D's not even coding for that catheterization. So let's go ahead and eliminate D. And that leaves us with A and C. And if you look at C, C is coding 75736, coding for that. And this is angiography, pelvic, selective or super selective radiological supervision and interpretation. Did we have a pelvic angiography? No, no, we didn't. We had an angiography, but what did we have an angiography of? Well, the left anterior descending and the diagonal artery. Hey, okay, so I don't think that's the right code, and we're going to eliminate C. And the answer, D. All right, coders, how do you feel? How do you feel? All right, some people might say, hey, they would have coded for this angiography. Well, if you didn't know this was pelvic, then you could also look at 93454. It is the code for your coronary angiography. This is what you would use this code for. All right, coders. If you got it correct, outstanding. But if you learned something, that is priceless. And coders, before I go and hand it over to Mrs. Tracy, I want to remind you, if you liked this instruction for the last 9 weeks, if you loved it, if you just attended one previously, or if today's the first day you attended, type in the is it description or discussion or the not in the chat, right below the video. Type there. Tell us what you learned. Tell us what you like. Let us know. And if you do that, coders, I have a big surprise to you. Now you have to have typed in that down below, type below this lecture, not in the chat. Come out of the chat and go down below and post on this video. All right, coders. It's time for me to hand it over to Mrs. Tracy. Oh, and by the way, we will announce what the prize is. We will announce the winner of the free course, and it's going to be awesome. All right, Mrs. Tracy, take it away.
I can I can hardly wait. We got lots in store for you guys. So just a couple more sections to talk about, and we will get to some more good stuff. And thank you so much, Mrs. J. Oh my goodness, I always love hearing Mrs. J teach about percutaneous coronary intervention. It was just one of those sections that I just could not grasp for the longest time. I don't know what it is when you start talking about coronary arteries and branches, your brain kind of like, I don't know, goes blank. So thanks again, Mrs. J. She always does a wonderful job of hitting those guidelines head on. And as she mentioned, to watch that additional video here on YouTube if you want some more information on, just to get some more practice with PCIs. Definitely watch that video here on YouTube. And correct me if I'm wrong, Mrs. J, but I believe it's also part of our lecture series as well. We have some videos as well on that. Okay, so have no fear with those PCIs. We got you covered. Okay, so let's go ahead and move on, and we're going to talk about allergen immunotherapy. And basically, this is they're otherwise known as allergy shots, and it's a preventative treatment for allergic reactions to substances, things such as grass pollen, house dust mites, and even bee venom, so bee stings and stuff. Immunotherapy involves giving gradually increasing doses of the substance or the allergen to which that person is allergic. And the allergy shots basically just decrease the sensitivity to allergens. And in most cases, it can lead to lasting relief of those allergy symptoms, even sometimes after the treatment has stopped. So let's go ahead and talk about some of the guidelines, okay? And not really, this isn't a big section, so these are your codes for your allergen immunotherapy, 95115 to 95199. These do include the professional services necessary for the allergen immunotherapy. You can use an office visit in addition to the allergen immunotherapy if there's other identifiable services that are provided at the time, okay? All right, and you can find that on page, and you can find this guideline and this set of codes on page 694. Okay, so I have and the guidelines, just real quick, let me just summarize it real quick. And I'm going to show you a little bit of Chun as well on this section when we finish with this. But your guidelines, you want to ask yourself, did the doctor prepare those doses? Did he inject them? And did he supply the allergen? Okay, so those are just some things to keep in mind when you're coding here. All right, here's our answers. A 95144 times 2, 95117, 99203, J30.81, J30.89. B 95165 times 2, 95115, 99202, J30.81, J30.1. C 95165 times 20, 95117, 99203, modifier 25, J30.81, J30.89. Or D 95165 times 2, 95117, modifier 25, 99203, modifier 25, J30.81, J30.1. A 25-year-old male patient arrives to the ENT department to see a specialist for the first time. He complains of severe rhinorrhea, coughing, and wheezing. Allergy tests administered by his PCP indicate several allergies to cat dander, mold, and dust mites. The patient arrives today to start allergen immunotherapy. The physician prepares 2 multi-dose vials. Each contains different antigens, and each vial contains 10 doses. At the same encounter, the physician receives 2 separate sorry, I said the physician, I meant the patient receives 2 separate injections of both vials prepared by the doctor. The patient is seen also for a detailed history and examination to assess the clinical status and to readjust the prescription drug treatment. How is this encounter reported? All right, y'all have a minute and a half and your time begins now. Good luck. Okay, I'm so sorry. I think my screen malfunctioned here. I didn't see my little bar going across, and when I clicked, the answer came up. So I'm so sorry, everybody. I'm so sorry. Okay, let's just go ahead and walk through this one, okay? And again, I really apologize. Okay, so our answer is going to be C, and maybe some of you already answered that. So let's go ahead and see what's going on here. Okay, we have 25-year-olds, ENT department, allergy test, PCP, several allergies to cat dander, mold, and dust mites, allergen immunotherapy. Physician prepares 2 multi-dose vials, different antigens. Each vial contains 10 doses. Same encounter. Patient receives 2 separate injections of both vials prepared by the doctor. And the patient is also seen for detailed history and examination to assess the clinical status and to readjust prescription drug management. Okay, so it looks like there's an E&M service done in addition to these injections. Okay, so remember what our guidelines said about that. Okay, so let's first get some visuals here. Okay, so as you notice, the answers aren't here on the page. However, I want to show some visuals that I got to give credit for these to Mrs.Jay. She really has a great way of explaining this. So basically what happened here, the physician is preparing 2 multi-dose vials. Okay, so we have our bottles here of our different antigens. Okay, so we are going to have 2 different antigens, right? And each one is going to contain 10 doses. Okay, so we have orange is going to be antigen 1 here, and there's blue is our antigen 2. All right, so it says each vial is going to contain 10 doses. All right, so we're going to put our 10 doses in each one of these containers. Okay, so there's our 10 doses of antigen 1. Okay, and there's our 10 doses of antigen 2 that's going to be given to the patient. So we have a total of 20 doses, right? Okay, and as it says, it's 2 multi-dose, so that's why we have 2 different here, and there's 2 separate injections. So we're going to have those 10 doses each in each one of these injections, right? So a total of 20, right? Everybody follow me so far on that? Sometimes it helps just to have a visual, okay? All right, so a total of 20 doses. So with that information, let's go ahead and move on, and we're going to look at our codes, okay? And I carried that visual over to this page just so you can see it, okay? All right, so let's go ahead and first look at that answer in A9, that first listed code in A95144, okay? And this is professional services for the supervision of preparation and provision of antigens for allergen immunotherapy, single dose vial. Okay, we have 2 doses, right? We have multi-dose vials there. So definitely that is going to be wrong, okay? We didn't have single dose vials, we had multi-dose vials, okay? So we're gonna get rid of answer A. Okay, now if we look at B, C, and D, has the same first listed code. However, those are all different because of the multiplier. Okay, we have a ×2, a ×20, or a ×10. So let's find out what's going on. So let's look at 95165, and that is for a professional service for the supervision of preparation and provision of the antigens for allergen immunotherapy, single or multiple antigens. So that covers a single or multiple, so that looks good. And it tells us to specify the number of doses, okay? That's a good hint right there on which multiplier we're gonna use. So which multiplier? Tell me in the chat real quick. Which multiplier do you think we're gonna use? 2, 20, or 10? Okay, I think I gave it away already. And if we look up at the top, remember, we had 20 doses. So we have to account for each one of those doses. All right, so that's definitely not going to be answer B because that's coding for 2. And answer D is coding for 10. So we'll get rid of B and D, okay? So now we're just left with C, okay? That's giving us the 20 doses that we need on that 95165 code, okay? So, but we always like to look at the rest of those codes. So let's go for it and let's go to the next page. And so we know that 95165 times 20 is a good code. And then if we look down at 95117, that's going to be professional services for allergen immunotherapy, not including provision or allergenic extractions, single injection. So basically, if you look at this this chun here, this is 95115. That parent code covers covers the doctor injection, okay, of that allergen. 95120 is when the doctor supplies the meds and injects as well. 95145 is doctor prepares and supplies, and that is for a stinging insect venom. So that's not going to be our code here, but that is basically at the that's for when the doctor prepares and supplies, and that whole code family goes from 95145 to 95149, depending on how many insect venoms were given, okay? And then at 95165, which is our first listed code there, that's the doctor is preparing and supplying that med, okay, which he did here. Now, what this is missing is the injection. So we would code 95165, and we're going to code 95117, okay? The parent is saying professional services for allergen immunotherapy, not including provision of allergenic extracts, 2 or more injections. Because remember, we had 2 injections there, so we're going to code that there at 95117. So 95165 covers the preparation and the provision, and 95117 is going to cover the injection. Okay, so we're going to need both of those codes. All right, because 95115 is saying that it does not include the provision. So we have to code, if the doctor provide it, we have to code for that as well, okay? So that's why 95117 is a good code now. And if you want to, I would advise to come back, either take a shot of this right now and document this in your manual, or you can come back and watch the playback, okay? And do your chanting. All right, so let's go ahead and move right along, and we have a final CPT code there, okay, 99203. And remember, back in the guideline, it says that if a separate E&M visit is provided, you can code that as well, okay? So that is what's being coded here, and we're gonna use that modifier 25 just to say that a separately identifiable E&M code was also provided the same day as these as this allergen immunotherapy, okay? And it says that the doctor, the patient was also seen for detailed history and exam, and his prescription drug was readjusted, okay? All right, so there you go. We're gonna code all that. And then your J30.81 and J30.89 is going to be the diagnosis codes, okay? And C is going to be the correct answer. Okay, so there's a little bit to sort through, but hopefully you guys understand that. And if you have any questions at any time, just please type them there in the chat. I have a wonderful team standing by for you guys. Okay, and with that being said, I think we're gonna move on to, I believe, our final section, okay? So we are going to talk about moderate conscious sedation. Okay, so conscious sedation is basically a combination of medicine. It's a sedative to help you relax and an anesthetic to block pain during a medical procedure, such as colonoscopy or cataract surgery. Okay, the patient just basically becomes relaxed and insensitive to pain, but they remain awake and usually still able to respond to verbal instruction. Okay. And there are three main factors in moderate conscious sedation. Um, so you have to know whether the provider is administering the sedation and also performing the surgery or procedure for which that sedation is required. Okay, if that's the case, there is a set of codes you're going to use for that. You also, the other thing is know if there's a different provider that's administering the sedation, independent of the one that is providing the procedure, okay? And also you need to know the age, okay? Know the age of the patient. These codes are going to be age driven, so definitely know that age of the patient. And also watch for the intra-service time, okay? So again, know whether the provider is administering the sedation and providing the procedure, whether it's a different provider. Also, the age would be the second thing, and the third thing is going to be the intra-service time. Okay, the time begins when the administration of the sedation agent is given, and it ends when the procedure is completed and the patient is stable and in recovery status. Okay. All right. So there is a chart here. I love this chart here on page 737. So it basically breaks down your moderate conscious sedation into the intra-service time, okay? So if it's less than 10 minutes, there's the patient's age there. Those are not reported separately, okay? So then when you get down to 10 to 22 minutes, if the patient is less than 5 years, that would be your code. If they're 5 years or older, that would be your code, okay? And take a peek at the top, depending on which column you're going to be in, is going to be dependent upon whether it was the same professional that provided the moderate conscious sedation plus the procedure, or if it was a different physician. Okay, so be mindful of those two columns. Okay. All right. So with that being said, if you want to use that chart for our next scenario, go right ahead. And here is our codes. We have A12036, 99156, 99157, B12046, 99152, 99153 times 3, C12036, 99152, 99153, or D12046, 99156, 99157 times 3. A 32-year-old male patient arrives to his doctor's office after sustaining a foot laceration when he dived for a catch playing football. The wound was not bleeding, but the skin was separated and needed repair. The patient has needle phobia, thus the physician decided to use moderate conscious sedation during the procedure. The PA administered PCS for 1 hour while the physician repaired the 20-centimeter laceration with layered closure using Vicryl 2.0. Which codes best describe this encounter? All right, coders. Okay, hopefully I don't show the answer this time. Be very mindful of that. I apologize for that last one. Okay, I'm going to give you a minute and a half, and your time begins now. Good luck. Okay, everyone, get your answers in the chat. I gave you a little bit of extra time, hoping to redeem myself. So get those answers in and let me know, did you use your chart on page 737? I know for this one, it would have been really helpful to use that chart. So let's go ahead and see what's going on here. Um, Looking at my first listed codes, recognize those as different than the rest, right? So those are coming from our intake section. Remember, we did that way back on week 1, right? Okay, so and then we have our moderate conscious sedation codes in our second and third listed code. Okay, so our answer here is going to be D, and let's find out why. So my keywords, I have 32-year-olds, office. Looks like my on clicks might be off. Sorry. So we have a 32-year-old, this PA administered PCS for 1 hour and repaired the 20-centimeter laceration with layered closure. Okay, so the first thing, remember, we want to ask ourselves the guidelines. We want to know what's the age of the patient, okay? So it's really important for moderate constipation. We have a 32-year-old patient. The patient is getting a repair of because they sustained a foot laceration when they were diving for flag, or sorry, when they were playing flag football. Sorry about that. Um, so and then we have to ask ourselves, did the physician or the surgeon that performed the procedure also give the moderate sedation? So those are the questions we have to ask ourselves. So we know we have a 32-year-old, and it says that the PA administered MCS for 1 hour while the physician repaired the 20-centimeter laceration. So basically, we have a different physician, right? That gave the PA administered the moderate conscious sedation, not the surgeon. So if we look at 99152, 99153, and we look at the parent code, the moderate conscious sedation here would be provided by the same physician that's providing the surgery, that is doing the surgery. This is not the case. Okay, we have a different, we have the PA that administered the moderate conscious sedation. Okay, so hopefully I didn't confuse you on that, but B and C are incorrect. Okay, all right, so we're gonna go ahead and look at 99156 and 99157. So then at our parent code 99155, that is when the moderate conscious sedation is provided by a different healthcare professional than the one who's performing the procedure, as what happened in this case. So I like that code. However, remember, we have to code the intrasurface time. And so 99156 is just for the initial 15 minutes of intrasurface time of a patient age 5 years of age or older. Okay, like that age there. However, we need a little bit more time, right? So we have an hour of moderate conscious sedation. So we have to code 99156, and we have to use an additional code, the add-on code 99157, for each additional 15 minutes. Okay, so we would have to code account for 45 more minutes. So we would use 99157 times 3 to account for that 45 minutes, okay, since that covers only 15 minutes of time. So in A, it's basically only coding for the 30. It's only coding there for 30 minutes. You're coding the 99156, which is 15. The 99157 is an additional, so that would be another 15. So that would only be 30 minutes, but we have to account for that hour, okay? So, okay, and it tells in our parenthetical guideline that we can use those codes together. And so we'll get rid of A, and D is going to be the correct answer. We have that times 3 right there on that 99157, okay? So that equals the hour, 99156 times 99157 times 3 equals 1 hour, okay? So got that taken care of. Now, finally, I just want to look at that 12046 to verify, and that is going to be the repair of that intermediate, that laceration, okay? And if we look down at 12046, it's covers 20.1 to 30.0. And you know what? Now that I'm looking at that, I think that that's the wrong code. I think it needs to be 12045. But as I would tell the coders in the classroom when we're dealing with a situation like this, we're going to pick the best out of our four. The best out of our four here would be D. However, I notice now that is only 20 centimeter laceration, so we're going to be coding it at 12045. Okay, but that's okay. D is the best answer of the four here, and that's all I'm going to say about that. And let me know in the chat if you got this. And I think I have one final scenario for you guys. Okay, this would be our coding challenge. All right, so everybody ready? Get ready. Okay. So here we go. We have A 90839, B 90846, C 99214, or D 90837. A 17-year-old established male patient a 17-year-old established male patient's family arrives to the psychiatric's office to discuss recent antisocial behaviors at school and home. At home, the patient is withdrawn and prefers to stay in his room. The patient's behaviors are more overt during school hours. Recently, the patient was caught skipping class, and at the same time, he was smoking marijuana, a controlled substance in this state. Additionally, all of the patient's teachers have documented defiant outbursts in class. Early intervention is necessary for prevention of a crisis state. The student refuses to participate in family therapy, but mother, father, and grandmother are present for a 25-minute session today. What is the correct procedural code for this encounter? All right, coders, good luck on the final scenario of our YT Advanced class. Your time begins now. Okay, get your answers in. And looking at my codes here, it looks like, I have 908, A, B, and D. All those codes begin with 908, so gonna have to read forensically there. And then look, we have a little E&M code that wiggled its way in there. So we have to be mindful of that as well. Okay, so our answer here is going to be dun, 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 dun. It's answer C. It's the E&M code is the winner. Okay, so all right, I'm going to quit being silly, but here's our keywords. 17-year-olds, established psychiatric's office, student refuses to participate in family therapy, mother, father, grandmother are present for a 25-minute session. Okay, so let's go ahead and look at these. If we look at 90837, which is there in answer D. That is for psychotherapy, 60 minutes with patient. Now, was this with the patient? It says that the student refuses. So this patient is refusing to participate. So we can't code this as with the patient, right? Because it's with the family. So we're going to go ahead and get rid of answer D. If we look at 90839, that's for psychotherapy for crisis. for 60 minutes. Again, this is going to be family psychotherapy, not with the patient, because the patient's refusing to participate here. So we're going to go ahead and we're going to get rid of answer A. And if we look at 90846, there is our family psychotherapy code that is for without the patient present, 50 minutes. Okay. Now, did you see the guideline? There's a guideline here, and I'm going to pull that up for you guys, um, because that looks like a pretty good code. But if in the guideline it says C codes 90846, 90847 when utilizing family psychotherapy techniques such as focusing on family dynamics. Okay, so that's what's happening here. There's some family therapy going on, but it tells us do not report 90846, 90847 for family psychotherapy services that are less than 26 minutes. Look, we have 25 minutes. So this guideline specifically telling us if it is less than 26 minutes, we do not report the psychotherapy code. Okay, so in this case, what would we do? We would have to go and we'd have to code the E&M service. All right, so we're going to get rid of answer B. And if we look at 99214 and you look at the time there, it says typically 25 minutes are spent face-to-face with the patient and or family. Okay, so 25 minutes here was spent with the family. So we're going to code this as a 99214 E&M code. All right, so that's going to be an established office visit because this was an established patient. All right, and that's it. So let us know what you think. What you think? Okay. And if you're like me, this is my face, and I think the rest, I could speak for the rest of the team, that where did that 10 weeks go? So when you realize the YT class is over, we really do want to thank you all. You've been an amazing class, and I want to bring the wonderful team back to the floor. Mrs.Jay, Miss Rochelle. Oh my goodness.
Yes, it was amazing. Mrs. Tracy, I think you can just take it on home from here, or if you want me to, I gotcha.
Okay, whatever you want to do, Mrs. J. I can
Okay,
take it on if you want me to.
it is up to you.
Okay, okay. Actually, Mrs. J, I'm going to hand it on over to you.
Okay, hand it on over. Okay, hand it on over. I hear a little ding in the background. It's saying ding, ding. Please
Oh.
disregard that ding.
Oh, I thought it was
Um,
on my side. I couldn't even hear it.
it's on my side.
Oh.
All right. So you did an amazing job, Mrs. Tracy. She just nailed it. Oh my goodness. You guys, how'd you do? Did you just not love that moderate conscious sedation? I did. I really, really did. All right. So we're going to start the screen off in this cute little baby. I love that baby. All right. So, what you all have been waiting for. Da, 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 da. The winner is Stephanie Bragg. Stephanie, congratulations. You are the lecture series winner. You will get our complete private lecture series content. You'll get to see it all. I can't even tell you all of it. It's ICD-10-CM, the complete series, E&M, the complete series, and every single chapter of every chapter, every other coding chapter. You got it all. Congratulations, Stephanie. And I told you I had a surprise for you, coders. I did. To thank you for leaving us a comment in the description or right beneath this lecture, right beneath this video, not in the chat, beneath the video. Guess what you win? You get this. And if you're watching the playback, we're not talking to you. We're talking to the people that stay to the end. You get this. Uh-oh, what do you get? Mrs. What? I didn't even see it in that envelope. Miss Rochelle is amazing. You get our CEU course, our Evaluation and Management CEU course. It is the complete evaluation and management instruction, along with, we even have a webinar auditing course. You get that too. And when you finish the exam, you get 22 CEUs. So great job. So how do you get it? Right now, go in the chat and get your link. But it won't work if you haven't put your response in the description or right below, not the description, below the description. You got to post. You got to post how you liked. Did you learn something? How you liked it? If you didn't learn it, put that there too. We want to know. We do, and we appreciate you. So if you did, your request will be forwarded over and you will get this prize from AMCI, and from our hearts to yours, thank you. Now, before you go, we don't want to just leave you. We want to offer a course again. We want to offer a full course, and here are some suggestions: ICD-10-CM, ICD-10-PCS, HCPCS Level 2, or modifiers. If you want any of these classes, go ahead and write them in the description below. Not description, below the description. Post it below the lecture. Below the lecture. Don't post anything in that chat right now. We want to see it because that chat goes away, and we want to make sure your response remains. All right? And if you don't want any of these, put what you want. We want to do it for you. We want to do it just right for you. All right, so if you have questions, make sure that you go to www.amcicoding.com. Ask away. We're here for you. And also, too, when you go onto our website, you'll see a little chat box. Go ahead and type in that chat box on our website, and we will get back in touch with you, or you'll be hearing from our customer service team in real time. All right, I think that's it. Congratulations, you did it. You did it. You did it. 10 weeks. You are, you're the best. And my hats are off to you. Yeah, I wear multiple hats. All right, coders. So what we're going to do is we're going to play our little theme song. And we're going to let you go ahead and fill out that form to get your CEU course. It's an awesome course. All right. And on that note, I'll say so long until next time.